Hello, my name is Dr. Alex Bartle and I was a GP for 30 years before I started sleep clinics 20 years ago. So I've got a particular interest in the impact of children's sleep on the family, on mothers and on society. The impact of a new baby in the family is often underestimated. It depends very much on the circumstances of that birth, of course, whether it's born into a nuclear family with mum and dad and the children, whether it's a solo mother family, for example, which needs a lot of extra support, or the baby may be born into a very supportive environment with parents and grandparents and uncles and aunts very close by. The mother's age, of course, makes a huge difference. If the mother is in her late 30s, she may already have had a career, and this means impacting on both her social network and her career, but also, of course, on financial considerations as well. Medical considerations also need to be considered. Mother may have had a difficult birth with a caesarean section or a difficult forceps delivery, which will entail her to be in hospital for a while longer. The baby themselves may be unwell and need intensive care unit care, which means mother's away from the family again for a longer period of time. So it does impact definitely on the children and the other families. With the birth of a baby, there's a change of focus within the relationships with both of the partner and other children. You can imagine a younger child and suddenly has another baby in the family, and they could be quite jealous. But if they're involved in the care of the baby, then it makes it much easier for the child, but also often for the mother as well. Fathers can also be affected, of course. Initially, of course, with a relationship with the mother, often they sleep separately because the mother's up and down to the baby all night. The bonding with the baby is less secure because they don't have this constant contact with the baby. They're not breastfeeding the baby, they don't have the close contact, and they're often at work for most of the day. Depression is not uncommon with fathers as well because they're often sleep deprived, but also they maybe feel a little bit left out of the party that's going on. So there's a change within the role of the family. Often they have to start looking after the other siblings and also looking after the household. Therefore their role within the family is often quite different. Of course, mother is the most profoundly affected. She's going to be very tired, which we'll talk about in a minute. Well, it's huge hormonal changes. They've just been pregnant. They're now not pregnant, but they're now lactating and having breastfeeding. So the hormonal changes are quite huge at this time as well. They're also become the primary care of the baby, and they're totally responsible for the baby and possibly other siblings as well at the same time. There is also less autonomy for the mother. Baby rules in the end. If the baby wants to be fed or sleep, then the mother has to respond to that, particularly in the first few months after delivery. Medical concerns also can come into play. The mother may be quite unwell, either with depression emotionally or with medical concerns. And of course the baby may also be failing to thrive in some respects, which just adds extra pressure. There are a number of factors that may be associated with a negative outcome. Some babies sleep extremely well, others don't sleep very well at all, within the same family. However, all babies will respond well to routine. Routine is so important for any baby. Remember that a tired, anxious and irritable mother will tend to lead to a rather more anxious and tired and irritable baby. So it's important that mum stays relaxed as much as possible. And remember that a well-rested baby during the day will tend to result in a better rested baby at night with less waking. And so it's much better, of course, for parents and for family. So what can be done to help? Remembering to maintain good sleep practices is so important. Such things as making sure that you go to bed at much the same time, that you're not relying on alcohol or caffeine to keep you awake during the day. You're spending time outside, which of course is great for the babies and children as well. So make sure that your bedroom's nice and comfortable. It's a nice relaxing haven to go to when you get a chance to lie down. Remember that you could share responsibility of the baby's care. If dad can get up at night and help out with resettling the baby or allow you to sleep in on a Saturday morning, that would be really helpful. And if you've got a chance to have someone helping out during the day, please accept any offer of help that you have. so that you can have maybe an hour when you can go for a walk or have a massage, but spend some me time is so important rather than devoting 24 hours a day to your baby. After 6 months, of course, it's time to start training the baby to sleep a little bit better by themselves, to resettle, soothe themselves back to sleep. So after 6 months is a good time to start retraining the baby so that you can start to get a little bit more sleep at night. When mothers get very tired, they tend to want to eat more and of course much less likely to do exercise. So motivation drops in terms of exercise. And of course if you're at home all the day, food is very available, so it is very tempting to eat more and do less exercise. Consider naps. 10, 20, 30-minute nap is fantastic, really very restorative, and in the end it will make a difference to how you feel at the end of the day. If you need to use any sleep aid, make sure that it's passed by your doctor and pharmacist first, and particularly if you're breastfeeding. Not all medications are safe. Avoid too many social events. You're not going to be out partying so late at night. But if you can keep contact with your friends, and particularly if friends have young children as well, it's really important to maintain social contact as much as possible. And beware of the dangers of sleep debt. Approximately 50% of mothers will experience some degree of postnatal blues, or baby blues as it's called. Often 2 or 3 days after the baby's born, after the euphoria of having the baby in the house, you've had this wonderful experience of having a baby, you're now tired, you're sore, you're breastfeeding, and you're becoming very tired, and suddenly the gloss is off this lovely new birth of the baby. So you can get quite weepy at that time, but it usually doesn't last more than a few days. The more serious postnatal depression occurs in up to 15% of mothers and is often spotted first by a partner, as we'll see in a minute. Less than 1% of mothers will experience the postnatal psychosis, which actually requires hospitalisation. So how do we spot postnatal depression? As I say, it's often the partner will notice it, and if the mother's had a history of anxiety and depression pre-pregnancy, it is much more likely that the mother will have depression after the baby's born. But it usually is manifest with weepiness, particularly low mood, can't be bothered, poor judgment and decision making, and often accidents as well. And if the mother's driving or having to look after other siblings, it does create a more dangerous environment. And so spotting postnatal depression and doing something about it at that time, going to see your health professional, is really important. Where the baby's born into a particular family, the parenting style is really important as well, that both parents are on the same page, particularly if the parents are separated, of course. So one parent may be very directive about the baby's care, and the other one may be very laissez-faire and permissive parenting style. But it can be very confusing if you're trying to look after this baby with two different styles. So make sure before the baby's born that you have an idea about what you'd like to do about the baby. Age of parents is also important. They may have had careers in the past which are now put on hold because of the baby. Financial situation, as I mentioned earlier, will be affected. Often parents in their late 30s and 40s have more confidence in themselves, but they're less able to put up with this constant getting up to the baby at night. So there are different aspects of aging of the parents. Complications at birth, of course, are perhaps more common with older parents as well, as it may be with the baby. Of course, very special babies, premature births, and babies that have been born through IVF, of course, are looked on as being very special babies. But I think it's important to emphasise that they are babies, that actually all babies are special, and they need to be treated in much the same way, and without perhaps too much cotton wool and extra care. Solo parenting is also very difficult, and it's really important to make sure that a solo parent has lots of exterior support. So, whilst it's wonderful to have a new baby in the home, there are occasional drawbacks, and remember that most of these can be managed. Thank you very much for your attention.